Hello, everybody. So again, tonight we're gonna have your Facebook Live on nursing prioritization and delegation. And before anything else, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. I have been teaching students for more than, I think, almost 25 years. And I'm also a nursing faculty at this time of a nursing program, helping students pass their licensure examination as well as a nursing program as well. Also, I am an author of a published book in Amazon. The title of the book is Simple, Fast, and Easy NCLEX Review. And you can see here that it's also available now in the Philippines as well. Okay, you can just email Matus Nursing Review Academy at gmail.com. If you want to have a copy of the book in the Philippines, it's going to be a black and white copy. All right, so visit the website and then you can get your copy. I know that there's a lot of students who have given their testimonials, 5-star rating. Okay, really liking the book because it is easy to read. Okay, and of course, I would like to let everybody know that if you don't know me yet, I'm the founder and the owner of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. Okay, so what is our agenda for tonight? But before that, I'm going to give a shout out to the first few people who came in today. So who are the people who are really very early tonight? So we have the following people. We have, let's see, who do we have here? So the ones who came in very early tonight was Presel Paz. We have Ma Selvi. Thank you very much for being here tonight and very early. Ayadi Deli, Janine Lubaton, Noel Burgos, Ayadi Deli, Loretta De Leon, and then also Amaka Oti and Jennifer Casido. So I'm giving a shout out to the first few people. So every Thursday, just wait for our posting regarding our schedule for our nursing participation and delegation Facebook Live. Okay, it's gonna be somewhere around this time, and if it is canceled, then we will make an announcement hours before that if there is no Facebook Live for the day. Okay, but most likely we have Facebook Live. All right, so again, let's have our list of agenda. Okay, so number one. Okay, so we're gonna show this, of course, our motivational photo of the week. So our motivational photo of the week was sent to us again by Sharon, and she's showing us her foods, of course, while studying. And I think that's really interesting. When you're watching the videos and then you have food. I think Sharon works, I think, night shift. I'm not really very sure about that, but she sent a photo. So really studying, even though you're so busy, everyone. So that's what you call the spirit, the motivation to really pass your NCLEX. Okay, all right. So next, we're gonna have your testimonial for the week as well. So this was sent to us by Gifty. She emailed me actually. She sent this email. She said, "Hello, Matus. This is just a short note to express my gratitude to you for affording me the opportunity to participate in your NCLEX tutoring program or the NCLEX review. I just passed my NCLEX exam, and you happen to be one of the resources that I benefited from. Once again, thank you very much for your input. It is very much appreciated." So thank you very much, Gifty, for your appreciation and for passing the NCLEX. Congratulations as well. Okay, I would like to make a quick announcement. It's going to be next week. It's going to be in April 24. We are going to start again our 10-day live comprehensive NCLEX review webinar. It's going to be every Saturday from April 24 to June 26, 2021, 8 to 4 p.m. That would be a Saturday class. This is a review program so that you can master your nursing core content. So for example, if you graduated many years ago, like 10 years, 20 years, or you're a recent nursing graduate, then you can attend this program to master your nursing core content and some few test-taking strategies, of course, and discussion of basic concepts in nursing. So it's an interactive online NCLEX review. We call it interactive because you have a workbook while I'm doing the lecture, and you do have also access to the online NCLEX Academy watching all of my recorded videos for 6 months after the class. Okay, so those are the benefits of the program. So just visit our website, www.matusnursingreviewacademy.com. We're going to share also the link in the comment section so that you know where to go if you plan to enroll in the program. So I'll see you everyone. Okay. And a very big announcement also, everybody. This April, coming April, we're gonna have our April Fool's Day sale, and it's only going to be 3 days, everyone. From March 31 to April 2, 2021, we're slashing off the price for our self-study comprehensive online NCLEX review course. If you're doing self-study, 1 year unlimited online access NCLEX review. If you're doing self-study, we're offering a 50% off, so it's going to be only $249.50 instead of $499. It's going to be a 1-year access. So the last time we did this sale was, I think, around February, I guess. So grab this opportunity, everyone, because it's half the price, and we only have a limited number of students that we can enroll in this program for 50% off. Okay, so that's we will also share the code for you guys so that you will know how to enroll in the program. Okay, so just send us an email. Okay, so now let's proceed to our next agenda, and that would be the free 90-day online access NCLEX review. So if you stay over immediately after this session or show, we're going to announce immediately who wins the free 90-day online NCLEX review. Okay, so let's see. So make some comments, everyone, and I'll also give you a shout out. Okay, and thank you very much as well, because we have a lot of students who have been emailing me, thanking me for the benefit, the positive benefits that they're getting from my YouTube videos. So about nursing prioritization and delegation. So I'm really very happy about that, because this is our 51st session actually. So we have done more than 50 sessions now. So 51st session, everybody. Okay, so congratulations, everybody, and thank you for your support, for always attending the session and always giving me feedback on how I can do better and provide you the best learning experience in this program. Okay. All right, but of course, if you can everyone share, okay, or click subscribe if you're watching the YouTube video, everybody, I would appreciate that, so that other students will benefit from the program as well. So what are you waiting for, everyone? Okay. All right. So my very first question for tonight is that, are you ready for the first question that we have? We have very interesting questions for tonight, and I am so excited. Thank you, Claire, for sharing. Thank you very much, Claire. Okay. And also we have a special message from Now and Forever, I Will Be Urman. So hello, sir. Thank you for your videos. I'm from Glendale, California. Okay. So you're welcome. Okay. So let's have the first question, everyone. This is going to be a prioritization question. So let's see who gets the right answer for this question. So let me read the question, everyone. The nurse performs walking rounds in the orthopedic unit after the end of shift report. Which client requires immediate intervention? A. The 26-year-old client with above-the-knee amputation who complains that the leg feels like it is still there. B. The 48-year-old client who refuses to use the abductor pillow after a hip replacement surgery. C. The 28-year-old client with gout who reports severe pain on the fingers and the great toe. The 35-year-old, letter D, the 35-year-old client with osteoarthritis who feels nauseated after taking ibuprofen. Okay, so let's read the question again. The nurse performs walking rounds in the orthopedic unit after the end of shift report. Which client requires immediate intervention? A. The 26-year-old client with above-the-knee amputation who complains that the leg feels like it is still there. B. the 48-year-old client who refuses to use the abductor pillow after a hip replacement surgery. C, the 28-year-old client with gout who reports severe pain on the fingers and great toe. And letter D, the 35-year-old client with osteoarthritis who feels nauseated after taking ibuprofen. So what do you think is the correct answer to this question, everyone? Okay, which one or which client here is going to be a safety issue? Okay, a client who is going to be a safety issue. Let's see if you get the correct answer, everybody. And can you please give your rationalization, your rationale, why you chose the answer? I would appreciate that. Okay, so why is it A, why is it B, why is it C, and why is it D? And thank you very much, okay, Mercy Fanor, thank you very much for your comment. Okay, watching me every day. Wow, thank you very much, Maurice Fanor, for watching my video every day. I'm really very happy that I'm helping people out there. Okay, thank you. All right, so what's the answer to the question, everyone? A few more seconds, and then we're gonna give everyone, okay, we're gonna give everyone the answer. So give the rationale for your answers, everybody. Okay, what's the reason? Okay, why you chose a particular answer? So when you answer questions like this, it's really very important that you are guided by your content. Without your content, it will be difficult to choose the right answer. And also, even if you chose the right answer, I think it's important that you have the right rationale, right? And it's always a learning experience. So even if your answer is wrong, that's okay, you know, as long as you're learning and you don't make the same mistake the next time, right? So, and that's why I really emphasize content understanding for all students before they can tackle critical thinking questions. Okay, so what will be the answer to this question, everyone? Okay, so again, you have to choose the client here who requires immediate intervention. Someone that needs to be seen right away, and you need to do something or else something bad will really happen. And you will notice that you have patients here who have problems, right? So, but then among those four, which one are you going to prioritize? Okay? So the answer to this question, everyone, is going to be yes, that would be letter B. You're all correct, everyone. Now, the question is, why is letter B the answer and not the other ones? Now, B is the answer because we all know that all patients after hip replacement surgery, you need to have an abductor pillow between the legs to prevent hip displacement or displacement of the prosthesis. Okay, so that's the reason why the legs must be abducted or spread apart to make sure that we prevent hip displacement, or else we have to do another hip surgery. Am I right? So the reason is not hip contracture. The reason is to prevent hip displacement. Okay, so that's very important. There should be an abductor pillow between the legs at all times. And you have to go back to your concept again. What are the important priorities after a hip replacement surgery? You have to abduct the legs. Okay, you have to avoid internal rotation of the legs. Okay, and also very important is that the patient should avoid bending. Okay, overbending, because overbending will flex the hip, and then that will also cause dislocation or displacement, which is really very important. Okay, so that's the answer, everyone. Letter B, Now, why is it that letter A is not the answer? So again, guys, when you read your concept on hip replacement surgery after hip replacement, the restrictions, the limitations, the positioning, those are all in the NCLEX. Okay? Review your concepts again, how many degrees the patient cannot bend forward. Review also the importance of having elevated toilet seats instead of low toilet seats, the importance of spreading the legs, avoiding crossing the legs, placing an abductor pillow. Do not wrap the legs in a blanket because the legs must be separate. So remember that, everyone. Okay? Now, your letter A is not correct. Why? Because after amputation, it is expected that your patient will have phantom limb sensation. Now, I'm not sure if everybody is aware what is phantom limb sensation. That is usually a sensation that occurs after an amputation wherein the patient still feels the extremity is still there. So it is a perception, okay? And it may persist for weeks or even years. So that's okay, letter A. Now, your letter C, you have a client with gout who reports severe pain on the fingers and toes. Letter C is very important as well, but not as important as letter B. Because your letter C, your patient with gout has pain, there could be an exacerbation of the condition, and you need to address that as well. But letter B will come first, okay? Because it's a safety issue as well. Now, your letter D is something that you need to address as well, because nausea, after taking ibuprofen can indicate also the presence of gastric distress. But is it more life-threatening compared to letter B? Okay? So B is your priority, everybody. Okay? So that would be letter B, everyone. That's going to be your final answer. Okay. So are you ready for the next question, everyone? The second question that we have is going to be very challenging. Okay. So what do we have here? Okay. So you call that phantom limb sensation. Okay. But phantom limb pain is different. Phantom limb pain is when the patient has pain after an amputation and you need to address that pain. Okay? All right. So let's proceed to question number 2, everyone. Let's see if you can answer this question. All right, get ready, everyone. The nurse cares for the following clients in the medical surgical unit. Which client should be seen first, ranked in order of priority? 1. The 36-year-old client who reports a small spot of blood on the cast after application. 2. The 52-year-old client who is scheduled for wound irrigation due to osteomyelitis. 3. The 28-year-old client with spinal cord injury who needs tracheostomy suctioning. Or 4. The 45-year-old client with gastrostomy whose feeding tube is clogged. So you have 4 answers here. You have to rank. Which one comes first? 1, 2, 3, or 4? So you put the numbers, everyone. What will come first? I'll give you a little bit of time, okay? But I will give a shout out to some people, okay, who just came in. Aurora F. Gerard, thank you for being here. Pasangdong Alama. Pastor Nicolas Obiero, and then Pastor, thank you very much for your review about my book in Amazon. Thank you very much. I think I saw your review about my book. Thank you very much. Katleya, thank you for being here. Sadia Saman, thank you very much as well. Jamlin, Claire Abad, Judith, Lorena also, Babita Dahal, okay? And Ivy Friels Nicolas, thank you for being here as well, okay? All right, so what do you think, or who do you think is the priority in this situation, everyone? Okay? All right, so let's see what will be the answer. So you have to rank who is the priority, who is the next, and then the next. So who do you think will be the priority in this situation? Who is in most danger? Okay, so let's see who is going to be the priority, everyone. Okay, this is a very interesting question. We have different answers from different people here, so We will find out later on who comes first, who's first, second, and third. I will give you a clue, okay? The correct answer starts with number 3. So number 3 is the answer first. So what will follow, everyone? Okay? So number 3 is the answer. So what will follow, everybody? Okay? The answer is going to be, all right. Okay. So a few more seconds and then we're going to give the answer, everyone. Okay. Don't forget your prioritization, airway, breathing, and circulation, safety, risk for infection, nutrition, safety. Those are your priorities, everyone. Okay. So the answer is going to be, all right. So the answer, everybody, is going to be, okay, so very interesting, everybody. Okay. All right. So the answer to this question, everyone, okay, the answer to the question, everybody, is going to be, let's see. All right. So that would be 3, 1, 4, 2. And I think some people placed 3, 1, 4, 2 there. Thank you very much, Janine. Janine came first. She answered 3, 1, 4, 2. Okay. We also have another person who answered 3, 1, 4, 2 as well. Nel Roma, congratulations for getting the right answer as well. Okay. And then we also have Judith Lorena. Congratulations for getting the right answer as well. Okay, Pasang Dolma Lama. Very good. Okay. And then we have a lot more people who got the right answer for this one. Very good. Now, number 3 is going to be the number 1 because it's an airway issue. So number 1 is you need to make sure that if someone needs tracheostomy suctioning because of a noisy respiration, because of having a lot of mucus, so you really need to suction, and that's going to be your airway. So that comes first, number 3. Okay. Then number 1 is the next answer. Why number 1? Because this patient, after CAS application, reports a small spot of blood. What are you going to do first? You go to that patient, you have to assess what's going on, the small spot of blood. You encircle the stain and then monitor if it's going to become big or not, right? Because one of the things we want to make sure here is if hemorrhage is happening or not, okay? So number 1, for this patient who may have a fracture, you want to make sure if it's a small spot, if it's getting bigger, if hemorrhage is progressing, and that's your circulation, everyone. Okay? So number 1, bleeding is a priority. Remember that. And then after that is going to be number 4 because this is clogging of the feeding tube. So number 4 does not really indicate your patient is in danger, but this can wait a little bit, you know? You can go back to your patient and then you can unclog the tube after that. So that's nutrition. And then the last one is number 2. Number 2, wound irrigation can wait a little bit. Okay? So the answer is going to be 3, 1, and then 4, and then your 2. Don't get me wrong, everyone. Nutrition is important. Okay? Nutrition is important. But then 1 comes first, the bleeding. But if, for example, your patient just had insulin, the person, for example, just had insulin given, especially if it's a rapid-acting insulin, and the patient will have hypoglycemia if there is no food in his stomach, then that will be a concern. Am I right? Because a person who skips meals and then the person just received insulin, that's not good because of the risk of hypoglycemia. So that's a different story. Okay? So the answer is 3142, everyone. So feel free to make your comments, everybody. I hope that you learned something on this question, everybody. Okay, so that was challenging a little bit, but hopefully that you learned something. And again, it goes back to the concept. Remember our concept before, that when there is a stain of blood on the cast, the nurse should encircle it and monitor if it's getting bigger or not. Okay, because hemorrhage might be happening inside. Okay, or internal hemorrhage. So for those who got it right, congratulations, guys. Okay, so are you ready for our third question, everyone? This will be your delegation question now. So let's see. This delegation question is going to be direct to the point. And then also, everybody, can you please what's this? Put in the comment section your location. Okay, so I want to find out where's your location, everyone, who is from around the world and who is from the United States also. Okay, and who also got vaccinated. No, don't put that, but I just want to find out your location, and that's it. Okay, all right. So for priority questions, someone is asking, Olatunde is asking, what tips can I use to tackle priority questions like this? So in my review program, I do tackle the concepts or the basic foundation of prioritization, which is airway, breathing, and circulation. But then, especially in my book as well, but then as you watch through my program, if you watch my videos, you will slowly understand what are the important concepts for prioritization. Okay, so always remember airway, breathing, and circulation. I did also tackle in the program before that patients with chronic conditions, those part of the symptoms may not be priorities. So you will learn it by applying it, by applying. But in terms of principle, I do have that in my program, and there's a lot of online resources as well. Try to find out first what are the basic principles in prioritization. Your question is great. Your question is valid. You need to know first the basic concepts on prioritization, and then you apply that in this program. Okay? All right. So thank you very much, Uletunde. Okay. Now let's go to our next question, everyone. Okay. So this will be a delegation question. So Noel is in Saudi Arabia. Okay. So Nimco Coca-Cola is from Minneapolis, Minnesota. Okay, we have Funky also from Houston, Texas. All right. Okay, so the registered nurse and unlicensed assisted personnel, or UAP, care for a female client who underwent radical mastectomy. Which task can be delegated to the UAP? A, elevate the swollen arm on a pillow. B, observe the client's emotional response. C, assess the color of drainage in the Jackson Pratt device. And D, instruct the client regarding planned exercises after discharge. What I would like you to do, everyone, is that when you're watching my videos, get your notebook and your pen and take notes, okay? So that you can learn the tips. So the registered nurse, RN, and unlicensed assisted personnel, or UAP, care for a female client who underwent radical mastectomy. Which task can be delegated to the UAP? A, elevate the swollen arm on the pillow. We have a little bit of a typo there, okay? Letter B, observe the client's emotional response. C, assess the color of drainage in the Jackson Pratt device. Or D, instruct the client regarding planned exercises after discharge. Okay, this is a direct to the point question. Okay, but I would like to give a shout out to the location of some of our students for tonight. So we have from Saudi Arabia, from Riyadh, Saudi Arabia, Horace, Mark, Daiti, Malagum. Okay, thank you, Horace. We also have from Nepal, Pasangdol Malama. Janine, hi Janine, how are you doing? It's been a while. I haven't heard from you. Janine Lobaton from Philippines. Delphine Badarnian from Kentucky. Okay. Okay. Olatunde Uluwakemi is from Nigeria. Okay. Jen TBC is from Florida. Okay. Well, let's see with delegation. Okay. Hopefully, when you're watching my videos, you will slowly understand what delegation is all about. Okay. So the answer is going to be, all right. So when you attend these videos, or when you watch these videos, I would advise you to watch online resources first, like what are the basic concepts about delegation. Okay. So from New York is Mary's Panard. Okay. All right. So somebody's asking, where is the actual review? We don't have any live classes at this time. Okay, we don't have live classroom because of the whole COVID situation, but we do have a live webinar. So you can attend my classes via live webinar. Okay, So live webinar, that would be starting April 24, and we will make an announcement as well if we have a live class later on. So hopefully the whole COVID situation will disappear. Joyce Flores is from Dammam, Saudi Arabia, and Jennifer Casito is from Hawaii. So the answer is going to be, let's see everyone. The answer to this question is going to be letter A. Very good, perfect. Everybody got it right, okay? So, hi Benedicta, how are you doing? So Benedicta is from California. Abidemi Sola is from Maryland. Okay, so for this question, the answer is going to be letter A, because anything that is positioning, ambulation, activities of daily living, that would be for the UAP or nursing assistant. So A is going to be the answer. Okay, now letter B, observing the client's emotional response, that's an assessment, and that's going to be for the licensed nurse. Letter C, assessment, that's for the licensed nurse. Letter D, that's going to be teaching, that's for the licensed nurse also. We have discussed in this program many times that RNs should never delegate assessment, okay, should never delegate teaching, and also evaluation, okay? So ADLs will be for nursing assistants. So anything that is not complex, anything that is just really simple, stable client, then that would be for your unlicensed assistive personnel, okay? How can you avail my webinar? So I'll put the link later on in the comment section, okay? So for the website where you can enroll for the webinar, okay? So just visit www.matusnursingreviewacademy.com. It's actually also there, okay? So good, everyone, you got the right answer. Now, the last one is going to be a challenging question. So hopefully everybody will get this right. This is also delegation. All right. Ayadi Deli said, "Sir, can I please have the high priority conditions?" Ayadi, can you please send me an email or send us an email and we will respond to you. Okay? All right. The high priority conditions. Nijina Djalilova is from Uzbekistan. Thank you very much. Okay? All right. Updating my book. Probably my book will be updated by the end of the year. Not a lot of changes, more of correcting the typos, okay? But it will be updated probably by the end of the year, okay? So, but it's not gonna be a lot of changes though, okay? Now let's proceed. So which task can be delegated by the registered nurse or RN to the unlicensed assistive personnel or UAP? I don't know why there's a word care there, but when caring for a client with recent weight loss due to anorexia, select all that apply. All right. So which one can you delegate to the UAP if you're the RN? And always remember, we said in this session that the RNs delegate to the UAP and LPN. The LPN can delegate to the UAP also. Okay, remember that. The RN can delegate to the UAP and LPN, and the LPN can delegate to the UAP. So is it letter A, record the amount of food intake each meal? B, remind the client to eat scheduled snacks? C, analyze results of weekly weights? D, discuss the client's nutrition plan? E, assist the client during mealtime? And F, assess the client's food preferences and habits. Okay? So again, which task can be delegated by the registered nurse or RN to the unlicensed assistive personnel or UAP when caring for a client with recent weight loss due to anorexia? Select all that apply. A, record the amount of food intake each meal. B, remind the client to eat scheduled snacks. C, analyze results of weekly weights. D, discuss the client's nutrition plan. E, assist the client during mealtime. Or F, assess the client's food preferences and habits. So which task can be done by the nursing assistant here? Okay, can the nursing assistant do A, B, C, D, and E, and F? This is a like all that apply question. And you do really have this in the NCLEX as well. Okay? All right. So it seems like everybody has given their answers. Okay. So let's have the answer to this question. All right. Put your final answers, everyone. Last 5 seconds. Put your final answers. 5, 4, 3, 2, 1. Put your answer, everyone. Okay? All right. So in this question, let's have the answer. Okay? So the answer will be letter A, B, and E. Very good. Congratulations. You just passed your NCLEX, everybody. Claim it. Okay? The law of attraction. Who believes in the law of attraction here? Who believes in positivity? Do you think positive every day that you can pass the NCLEX? Okay? Tell the universe that you want to pass your NCLEX. Dream it, work for it, and then achieve your goal. Okay? A, recording the amount of food intake each meal, the percentage. Of course, the nursing assistant or UAP can do that. Letter B, reminding the client to eat scheduled snacks. Yes, correct. Letter E, assist the client during mealtime. Yes, the nursing assistant can do that. Very good. Those are all activities of daily living. Very good. All right. So letter A, recording the amount of food intake each meal. Correct. B is correct. Now letter C, analyzing results of weekly weights. Analysis is higher level thinking. That's a complex activity, and that would be for the licensed nurse. Analyzing if there's a weight gain or if there's weight loss, okay? Or you can say comparing results, okay? So that would be for the licensed nurse. But if it is measuring weights, then that would be for the UAP, measuring daily weights or measuring your height. So C is for the licensed nurse. Letter D, discuss the client's nutrition plan. That's another way of saying teaching. Teaching is for the licensed nurse. Okay? The UAP can remind simple things or simple tasks like letter B, but letter D, nutrition plan, discussion of that, that would be for the licensed nurse. Okay? Letter F, assess the client's food preferences and habits. That would be for the licensed nurse, especially the word assessment, interviewing, especially the importance of food preferences and habits as well. Okay, so hopefully that you get perfect in this. I think a lot of people got it right. Okay, so congratulations. And then Fresel said, "Thank you, sir, claiming it." Yes, exactly. You have to claim it. The law of attraction. You have to manifest it. Now, one activity that I would tell you, everyone, is this. Okay. You put in a piece of paper, you will pass the NCLEX. And then write down all those negative thoughts that you have. So if you say, I graduated a long time ago, I cannot make it, write that down. And then after you listed everything, okay, all those negative thoughts, erase them. Make a straight line. And beside that, you would rather say, I can do it. Okay, I can make it. I am smart. I can do this. I am motivated. So that's how you fight, because it all starts with eliminating your self-limiting beliefs. It's really important to have that positivity, okay, to manifest your dream. Okay, you tell the universe about it, and then of course you pray, and of course what can happen is it will follow, definitely. Okay, so believe in yourself, everyone. Okay, so never doubt yourself. That's the most important thing. And I always tell the students to have the right resources in front of them. Okay, because learning is difficult. To review for the NCLEX is difficult, but there are techniques, there are materials available for you so that you can learn easily, and you will enjoy it as well. And students always ask Mr. Allen, what is the best way to prepare for the NCLEX? I would tell them that, number one, you have to be organized, you need to be positive, you need to be motivated. But again, I would tell students the number one thing is you want to be a nurse because you want to be the best nurse and you want to learn. So number one is, when you prepare for the NCLEX, enjoy the process of learning. Enjoy it. Because if you dread opening your book, looking at the questions, then you will not like it. So you have to be inspired and be motivated. Okay. All right. So let's have just a little bit of a plug-in about our program, guys. Of course, our online NCLEX review, we offer that. We have different pricing plans for you. We have 3 months, 6 months, and we also have 1 year. And this is really designed for um, working people. So if you're working and then however you want to review your concepts in a simple, fast, and easy manner, like especially if you graduated many years ago, you can use our workbook. I lecture everything from fundamentals, advanced nursing concept, and the curriculum is arranged in such a way that it's progressive. It's arranged in such a way that it's not complex. Um, my specialization is curriculum development. So I understand theories of learning and how curriculum should be organized for students to learn, and understanding also the theories of learning, especially the use of multiple senses so that you will learn. Okay, so we have a workbook, so please visit our website. That will be www.matusnursingreviewacademy.com. And I'm really very happy about this program because this is our answer to the call of the times, where students can sit, and watch the videos and really learn. So you live in a time, everyone, we're in. You are so lucky because you have a lot of resources in front of you. When I was a nursing student many years ago, everyone, we don't have these videos. We don't have these practice exams online. But now, everyone, it's right in front of you, okay, at your fingertips. So enjoy the process of learning because you have videos in front of you. All you have to do is just really get motivated. Every time you feel sleepy, then drink coffee or take a shower, and always remember the reason why. And you need to visualize your motivation. Put in a piece of paper why you want to become a nurse. You put that in a piece of paper and you really write it down and see that every day, so that you keep reminding yourself the reason why you want to pass your NCLEX. Okay? You need to visualize, have a visual board, everybody. Me, when I was reviewing for my NCLEX or for any endeavor, I always go to my laptop and always look at pictures. It keeps getting me motivated. Okay? All right. So also, since we're talking about positivity, so you can always carry this. If you want to be part of the Matus tribe, it says, I can do it and nothing else will stop me. Then, of course, that's important. Erase all the self-limiting beliefs and make sure you are surrounded. So this is also in our website, and we will post the link as well. Make sure you are surrounded by people who gives you positive energy, people who doesn't give negativity. Surround yourself with people who support you in your endeavor to pass the NCLEX. Okay? All right. So, okay. And then for last week also, everyone, we have our winner for the 90-day free online NCLEX review. We have Mulu Hadera, everyone. So please congratulate her. So after this session, everybody will be posting immediately the winner. So Muli Hadera is our winner last week. Please give her congratulations, everybody. She's enrolled now in the program, and so far she likes it. Okay, so thank you, Mulu. Now, just a shout out to some people who gave us very good feedback tonight. Pasang Dol Malama said, thank you so much for the motivation. Yes, of course. Never doubt yourself, everyone. Okay, and also Gian Torres. Okay, so think positive always, everyone. Okay, use the calendar, use the resources in front of you. Okay, so anyway, everybody, I really appreciate you for being here tonight and for joining me in this session. Okay, and again, our overall goal in this program is to make your NCLEX review simple, fast, and easy, but making sure that there's no shortcut. It has to be the core content that you need for your NCLEX review, and we don't jump from one topic to another. It has to be organized and systematic. Okay, you can try enrolling in our program. There's a free one-day trial. Find out if it fits your learning needs, and if you don't like it, it's okay, but then try the program if you want, everyone. And again, have a great night, everyone, and enjoy your weekend. See you again next week.